Good evening and happy Juneteenth to all. And I hope you're having a great holiday day off. I was working today. Work never cease at Montgomery Heart Wellness. We're always working to improve people's lives. I come to you today with a tragic story. Unfortunately, another tragic story about a young man who died suddenly. Many of you may know the local Houston rapper, Milton Powell, and he was known as Big Pokey. And he was, I'm not really big in the rap community, but I did hear some about Big Pokey before he died. Yesterday, I received a notice about his collapse on stage. So, Big Pokey performing in Beaumont collapsed on stage, is on video. That video went viral. I will not show that video tonight. However, what I want to do is discuss some key issues related to Big Pokey's death. Now, he was recognized by Mayor Turner, the mayor here in Houston. The city of Houston, I extend our prayers and condolences to our own screwed up click legendary rapper, hashtag Big Pokey, family and friends, the mayor wrote. So Big Pokey was well known in the Houston area and also Harris County, and was a rising talent, and died suddenly at the age of 45. Uh, I'm a cardiologist, and as a cardiologist, I like to look at these issues and examine them from a medical perspective. So, my question to you this evening is what can we learn from this tragic death of Big Pokey? And I want to go over some of the facts, things that we know, things we don't know, and try to piece this together. Now, as many of you are aware, Big Pokey collapsed on stage. I watched that video a number of times, and one thing that was obvious to me was that he still had the mic in his hand. Now there was reports of him breathing heavily, so I didn't have any sound on the videos I saw, so I couldn't determine whether he was breathing heavily into the mic or not. But those were reports. However, I did see that he did have the mic in his hand. He was standing near the guardrail. There was a large crowd before him, and he started what it looked like he started to rap, and all of a sudden he went back. Now, the collapse is important. How he collapsed is very important because he went straight on his back. There was no attempt to catch himself. There was no attempt to block his fall, etc. And what that tells me is that he had lost consciousness before hitting the ground. In fact, his loss of consciousness was what caused him to fall. Now, that's an important differential because as a cardiac electrophysiologist, when I evaluate patients who come to me and they say, well, I passed out. And if I see that I see scars and scratches and bumps on their face or their head, that makes me think that they lost consciousness as a mechanism of passing out. And they lost consciousness likely due to an arrhythmia. Some people can lose consciousness due to what we call vagal spells, or some people can have, say, hypoglycemic episodes and lose consciousness due to that. But those mechanisms of losing consciousness are more gradual, more subtle. If an arrhythmia hits, you drop like that and you don't have time to protect yourself. So let's look at, evaluate what we know, and let's look at the information we have based on what happened to Big Pokey, and let's see if we can put these things together. And hello, everyone. And before I get into this, I want to say if you're new to this channel, please subscribe and hit the thumbs up button. Give us lots of love. And of course, share this video. This is going to be very important information I'm going to share with you. And you may have loved ones or friends who can benefit from the simple but what I think is profound information that's going to be shared today. So hello to everyone online, Aaron Dawes, Shaquille Oatmeal, Danielle Harding. Hello to all of you and welcome. Now, what do we know? Big Pokey died suddenly. There was a video witness account. As I said before, he dropped dead. And we know he's a black man over the age of 40 years of age. He's 45 years old. And we can tell that he was obese. So these are things that we know about him. And these are important characteristics because, again, whenever you try to piece together a clinical diagnosis, and I'm not making a diagnosis, I'm giving a diagnostic theory. I'll say a differential diagnostic theory, but you want to put together information that you know about the patient, in this case, the individual who died suddenly. And this, by the way, is what the coroners use when they try to determine a cause of death. They will call, say, a physician like myself who knows the patient or who knows something about the patient and says, what were the circumstances of the death? What did you know about the patient with the history? So this is along the lines of what's typically done in the situation when you're trying to piece together, understand why someone died. So there's some likelihoods. He, as a 45-year-old Black man, he had a 58% chance of having hypertension. He may have smoked. I don't know this for a fact, but I saw some of his music videos where he's smoking. That doesn't mean he's a regular smoker. He may have just been posing in front of the camera, but I just checked that off as a possibility. And he may have eaten the standard American diet. Again, I didn't follow his dietary habits, but growing up in Houston and in the Houston area, there's a good chance he ate the standard American diet. And this is a risk factor for cardiac disease. And so we have to examine all of these possibilities. So given these possibilities, and I want to show a graph. This is data from the Journal of American Heart Association that showed hypertension prevalence in Blacks and whites. And you see here the top bar, Black men. And by the time you reach the age of 45, there's about a 58% prevalence of hypertension. So as a 45-year-old Black man, he had a nearly 6 out of 10 chance of having hypertension based on the data. Now, what are the general risk factors for cardiac arrest? So let's just step back. Now we know specifics about Big Pokey. Now let's step back and just look at general risk factors as we know them. Generally, people with a family history of coronary disease, people who are smokers. Now this is in red because of the possibility in Big Pokey. Also high blood pressure, again, a possibility in Big Pokey. High cholesterol, obesity, again, what we knew about Big Pokey. Diabetes, we didn't know about him having that inactive lifestyle. And many of you are going to ask in the chat, so I'm going to go ahead and address this. Myocarditis from certain immunizations. And this is a key point, and I will touch on this as a plausibility, although we do not know his immunization status, but many people are going to ask about this. I'm going to address it directly. And so here we go. What is my differential diagnostic theory? Based on the little bit that I know, my vast clinical experience and vast experience as a cardiologist, cardiac electrophysiologist, what do I think were the most likely cause? And I list my top 5. Number 1 is primary cardiac arrhythmia, either ventricular tachycardia or ventricular fibrillation. Number 2, primary cardiac arrhythmia due to either ventricular tachycardia or ventricular fibrillation. And number 3, primary cardiac arrhythmia due to ventricular tachycardia or ventricular fibrillation. Now, number 4, he could have had a heart attack with a secondary cardiac arrhythmia. Okay, and I'll talk about that in a minute. And number 5, he could have had a massive blood clot to the lung called pulmonary embolism. It would likely have to be a large one, and we call it a saddle pulmonary embolus. But this is the likelihood. If it's a blood clot to the lung, it would have to be a very large one to cause this kind of arrhythmia. Now, this kind of sudden arrest. Now, let's talk about cardiac arrhythmias. Why do I think it's the top 3 causes? Now, let's look at a normal electrical signal that passes through the heart. Now, many of you had an EKG before. You may notice those squiggly lines. You have a little bump, a spike, and a hump on the squiggly lines here. Now, this little bump, the first bump, is due to electricity going through both of the upper chambers. The upper chambers of the heart, they squeeze first, so they get electrical signals first. There's a little tissue bundle right up in this corner here. We call it the sinus node. That's your God-given pacemaker. So your God-given pacemaker sends off an electrical signal at a certain rate. Okay, it may do it at 100 beats a minute. It may do it at 50 beats a minute. It may do 150 beats a minute, etc. But it sends it off at a certain rate. It receives signals from your brain. Your brain may say, look, we're being chased by a bear. Let's speed up. You got to speed up the heart, speed up the legs. It may say, look, we're relaxing, sleeping, slow down. And so this gets central nervous signals from the central nervous system, and it tells you how fast to beat. So the rate is determined by the rate in which the signal is sent out. Now, it starts in the upper chamber, and once it's gone through the upper chamber, it goes to what's called the AV node, and that creates electrical silence. And then it goes to the ventricle. So now it passes through the ventricle, and that creates a larger spike. Now, the spike is larger here than this hump because this tissue is much more muscular. So it sends out a bigger electrical signal. Once this has been depolarized, it's what's called repolarized. So when electrical signal passes through muscle, it causes electrical negative ions to go from the inside to the outside, and then it has to go back inside to repolarize. So you have repolarization of the tissue. So here's a normal EKG here. And you see every one of these bumps, spikes, and hump represents a heartbeat. So here's a heartbeat. There's another heartbeat. And the farther apart they are, the slower the heartbeat, the closer they are, the faster the heartbeat. So you get a bump, spike, hump, bump, spike, hump. And so this is a relatively normal EKG. There's some non-specific T-wave abnormalities here, but for the most part, relatively normal. Here is what may have happened to Big Pokey, in the sense that you had like a normal beat here. This looks a little abnormal. Then you got this little bump here. It's farther away from there. That looks a little abnormal, but still a normal spike. And then all of a sudden you get these weird erratic beats. That's called ventricular tachycardia and ventricular fibrillation, because this is really ventricular fibrillation because it becomes erratic. Same thing here, it becomes erratic. So if you had an EKG on his chest at the time he was up at the mic, and when he fell back, you would have seen this. And here's another image, ventricular tachycardia. You may have seen something like this. And if you get to someone in time with a defibrillator, you can detect this and you can shock them out. I don't know the details of what happened in terms of resuscitative efforts. So those are my top three in the differential. What's the number 4 is a heart attack, but not just a heart attack alone. I'm thinking if he had a heart attack that caused this, it would have been a heart attack that triggered an arrhythmia. So my first 3 are primary arrhythmia, not due to a heart attack. Number 4 is a heart attack causing arrhythmia. The vast majority of heart attacks do not cause arrhythmias. What you have here with a heart attack is you have a situation where blood is flowing here, and you see a plaque. So you can magnify this, and this plaque will rupture, and then platelets form, and they form a clot, and the blood flow stops, and there's no more flow past here, and the muscle past here. You see this dark brown. This muscle tissue is dying. That's the mechanism of a heart attack. And so that's what you have. Typically, people have chest discomfort. And sometimes people have no symptoms at all. They can have a heart attack this big and not feel it, or may have symptoms that are so mild they relate it to something else. This is an EKG that shows evidence of a heart attack. I'm not going to go through the details with you of it, but you see what's called tombstones, okay? Now, where you would normally have to see a spike, okay, you see a spike here, but it's a wide spike. Okay, but you see the tombstone. This is a heart attack. This looks like a widowmaker type heart attack because in the front anteroseptal MI, and you start to see decrease in these R waves early on with a Q wave there. So this is a massive heart attack. Now the other way a heart attack can cause sudden death, if it's such a massive heart attack, you have what's called ventricular wall rupture. So the wall can just burst and they can bleed out. So that's the other mechanism that's not as common as a heart attack causing arrhythmia, and still not as common as a heart attack not causing any sudden cardiac arrest. The number five item on my differential is pulmonary embolism. Now, what's a pulmonary embolism? It's a pulmonary lung embolism is something that breaks off, a clot that breaks off and shoots off into a distal location. Most pulmonary emboli starts in the leg. So oftentimes when we have someone with swelling in the leg, so if you have swelling in the leg, especially unilateral swelling, and it's swelling and painful, you need to get evaluated for blood clot in the leg, because the blood clot in the vein in the leg can go up all the way up to the heart. When it gets to the heart via the inferior vena cava, here's a clot. It goes up the inferior vena cava, the upper right chamber, across this valve, up the main pulmonary artery trunk, and then go to the left or the right. In this case, it can go to the left. Now, the massive pulmonary embolism I was talking about is one where you have a large clot that squeezes up here and it shuts off both this side and that side. It sits across this, what called a saddle. We call it a saddle pulmonary embolism. And that can kill you all of a sudden. Now, I've seen people with saddle pulmonary emboli who survive it. So a saddle pulmonary emboli can kill you, except for when it doesn't. And so you can't have these major pulmonary emboli. It has to be treated right away. But again, my thinking is that Big Pokey suffered from a primary cardiac arrhythmia. It's very possible that he had a weak heart, maybe due to high blood pressure. Could he have had myocarditis due to immunization? I don't know. That's possible. Could he have had a blood clot to go? He could have, but I still think a primary arrhythmia would be the more likely cause of his cardiac arrest. Now, someone says I can't hear anything. Oh my goodness. Great night. Was it heart related? Okay, I hope you can hear. Put a 1 in the chat if you can hear. Put a 2 in the chat if you can't hear. My microphone is on. I tested. Everything looks good. It'll be a tragedy if this is all on mute. But anyway, what are the basic cardiac testing? Basic screening testing start with, great, I see a 1, so at least Angel can hear. Basic cardiac testing, and cardiac screening is important. So if you may be at risk, you may have some of the risk factors I listed, or you may not have risk factors I listed. You should have some basic cardiac screening. Cardiac disease is the number one cause of death. Everybody's running around, testing for COVID. They're still running around testing for COVID, and I'm not against you testing for COVID. But cardiac death, even during the worst of the COVID pandemic, was the number one cause of death. It never ceased to be the number one cause of death. So you have a much greater chance of dying from a cardiac arrest, similar to a Big Pokey or heart attack or some cardiac-related illness, than you are from COVID-19. And so let's get into these cardiac testing. And before I get into more details, give us a thumbs up and give us some love on the channel, and also subscribe if you're new to the channel, and share this. So a cardiac electrocardiogram, or an EKG as many people refer to it as, is a basic electrical test of the heart. You put the electrodes on the heart and you see what the electrical signals on the heart is related to, while you're at rest. Now, this can tell you a fair amount of information. It's not the end-all be-all, but it's a very important starting test. It's very simple to do and very inexpensive. You can find out whether someone has some diseased heart. Sometimes if I look at the EKG and say the QRS duration's wide, or some of the repolarization abnormalities are there, you can see someone may have had a heart attack before. So there's certain things your cardiologist can see on this test to determine whether or not you may have had something in the past that you're not aware of. We often pick up, patients who've had heart attacks before and they didn't know it, and we can see it on the resting EKG. So you can start with a simple, inexpensive test such as an electrocardiogram, and that will give you a lot of information. A regular treadmill stress test. Now, when I say regular treadmill stress test, this is when you walk on a treadmill and you just do an EKG stress test. You can also do nuclear stress or echo stress, but a regular EKG stress test gives you lots of information. Number one, it determines, how your EKG does when you're walking. It can screen for arrhythmias. It can screen for repolarization abnormalities that may tell you whether or not you have plaque in the arteries or blocked arteries. And it also gives you hemodynamic data, and it gives us information related to your fitness levels. So some people, maybe due to dehydration or poor fitness levels, they have a rapid heart rate at a very low exercise level. And so it gives us lots of basic information in terms of your cardiovascular performance and fitness. Echocardiogram, that's an ultrasound of the heart. This gives us a very important information in terms of the anatomy and function of the heart. It lets us determine how well your valves are functioning. We can see swelling around the heart called pericarditis or pericardial effusion. We can determine where you have congestive heart failure or if you have hypertrophic cardiomyopathy. So there are lots of things we can screen for with just a simple echocardiogram, and you get lots of information. It's a relatively inexpensive test. Depending on where you go, you may be out, $200-300. Some places may charge more than that, but most insurance companies cover this if you have risk factors for cardiac disease. And last but not least, there's some basic cardiac testing that relates to blood tests. Now, blood tests can be important. We have lots of new tests nowadays it gives lots of biochemical information. A basic comprehensive metabolic panel looks at your blood chemistries, electrolytes. Most of the time it looks at your liver enzymes. Complete blood count will help screen for anemia or low platelets. Basic cholesterol levels are important to determine your risk factors of coronary disease. Now, high sensitivity troponin level, I like to get this in my clinic because this measures whether or not your heart muscle cells are under stress due to lack of oxygen or a condition known as ischemia. And so we typically go measure regular troponin in emergency rooms to rule out heart attack, but you get an ultrasensitive troponin, it may be abnormal. You may not if an ultrasensitive troponin test is abnormal, you're not necessarily having a heart attack, but your heart muscle cells are under stress due to poor oxygen flow. And NT-proBNP, BNP stands for brain natriuretic peptide. This looks for stress on the heart muscles in general. We see this in patients with heart failure. And HSCRP, this is a measure for inflammation. And many of you are concerned about the immunization and it causing myocarditis. The high sensitivity troponin, NT-proBNP, and HSCRP are blood tests that can help screen for this underlying inflammatory process that may be associated with myocarditis. And lastly, I want to send our thoughts and prayers to Big Pokey's loved ones. It's a tragic death, and I really want to educate the general public because sudden death is a very prominent cause of death. We're seeing younger and younger people dying suddenly. And of course, they're having all sorts of medical issues, stroke and diabetes and the like. But cardiac arrest is a major cause. So if you got a lot of this, again, give us a thumbs up. Subscribe to this channel. I also did a story on Deion Sanders. Many of you may be aware that Deion Sanders may be at risk for losing his foot. I discussed that in detail and share lots of important information there. So if you haven't seen that video, go to our channel on YouTube, Montgomery Heart and Wellness, and find that video. It has lots of important information. So thank you very much for joining us tonight. Again, subscribe, thumbs up, and share. And please share this with any and all of your loved ones. And until next time, be safe and take care of yourself.